Why aren't the makers of Truvada advertising like crazy?
Yeah.
I asked them to come here and so they could talk about their assistance programs, and they never answered my email. So go ahead.
So I can't speak for them. I don't know why they do what they do, but they made a decision when the PrEP data came out and when the FDA approved Truvada in 2012 for prevention. It's been long-standingly approved for HIV treatment. That they were not going to market it for prevention because there was so much negative energy around PrEP, specifically from one agency based in Los Angeles, that's actually a worldwide agency that some of you may have heard about this, that went to bat quite fiercely to prevent the FDA from approving it and has created an enormous amount of negative press around the use of Truvada for PrEP. So Gilead was, I think, extremely gun shy from that experience and made a decision they weren't going to market. They did fund educational initiatives with community-based organizations, but they made a decision as a company that they were not going to market. That's now all changed. They are now marketing like banshees. They are contracting with physicians and providers across the country to go out and do speaking tours to other providers using a promotional sort of mode, and they've decided now they are going to market it. I don't know what caused that change, but you're going to be seeing a lot more. Maybe Eric has some insights. I'm not sure which.
We've actually pressured Gilead for about 6 to 8 months now to come out and stand behind this product. And the elephant in the room is called AHF, and I'm just going to say it because I've been the one that's been speaking about it all the time. And it was attacked as a party drug, and people would get more risky, and people would do all of these crazy things that we just talked about that we just haven't seen happen. And in reality, being a community representative, I speak to a lot of my brothers and sisters out there, and I'm sort of like, well, you know, how do you feel? And some of them say, yeah, well, you know, I sometimes just don't use a condom anymore because I'm not, you know, I feel better protected through my pill. For others, it's the other way around, and for the next one, it's like, well, you know, I just didn't feel like doing the pill, so I keep sticking to my condom. So the discussion is very diverse, and what we've done is we've pressured Gilead as well as the city of San Francisco. We've been talking to the state senate. We've been sending letters to Washington. We've been sending letters to the CDC. I sit on the HIV commission in Los Angeles County. I vice it, and I'm hopefully getting my commission seat soon. But so we're doing as much as we can, but there's a lot of processes in the background, and a lot of people are very, as you just said, gun shy, because a lot of organizations just don't have the funding to survive a lawsuit. And I think that the more data comes out, the more confident we get that this is true, and that we can actually really look at it, and we can take it, and we can say this works. And now it's really come to the point where this is being pushed more. And just to say this too, the copay that I just mentioned was actually just increased in October, which was also due to community efforts of people calling Gilead, sending emails, sending letters, sending petitions saying, we want more support, we need more of this. And the same is happening now in Canada, it's happening in the United Kingdom, Germany is discussing it, so there's many more countries, because right now the US is the only country that's the forerunner on HIV prevention like this. And all the other countries are a little bit behind. So it's happening on a scale. But considering 1981 to 1994, I think we're moving at a pretty damn good speed.
Denise Smith, this question is for you. Where in Bakersfield can I get tested?
The health department offers HIV testing Monday through Friday, pretty much coming in anywhere between 8 to 4:30, 8 to 5.
And it's free, right?
Yes. And then Clinica Sierra Vista also offers testing in a lot of their facilities. You can come in for STI testing and get an HIV test also.
Is Planned Parenthood one of those?
I'm sorry?
Planned Parenthood, are they informed about this?
Planned Parenthood.
And Planned Parenthood does some HIV testing as well.
Where do I even begin with the process of obtaining PrEP, currently uninsured? Covered California is the first place you should start. That's my opinion. Do you have anything different? I mean,
I think getting on insurance, if that's an option for you, is the best first line, because even if you get on the Gilead Assistance Program to get the medication without insurance, you need a way to be able to pay for the testing that goes with it. So getting some form insurance is really required at this point to do this. But we need better methods for people who can't get on insurance. But unless some of you know of ways to do that right now, I don't.
I can only speak for LA. I don't know about the organizations here in the city, and the Department of Health will probably be a really, really good contact for this. But in LA, the LA LGBT Center, as well as APLA and about 6 other organizations, you can actually go to them. They have medical services like doctors, etc., that will do all of the blood work. They will do everything. They are authorized to also give the prescription. The way that they operate is that they come from public funding as well as donations. So they look at your annual income, and then it's sort of, the cost sharing is a little bit on a sliding scale. So there is a way, even if you're uninsured, but with the Affordable Care Act, it's really well done to look at insurance and see if there is an option to get insured.
and you can find out if you're eligible for Medi-Cal through Covered California.
Yes.
And Medi-Cal does cover it. So.
Yes.
And in Kern County, there's 2 different Medi-Cal providers: Kern Health Systems, which is Kern Family Health, and Health Net. Their formularies don't have it, but it's part of their carve-out, part of Medi-Cal's carve-out. So Medi-Cal will cover it. The providers don't. So, but it is covered.
And Robert, I'm on Blue Cross Blue Shield, and my doctor prescribed it, and they didn't ask any questions. I sent it to the pharmacy, and they just filled it. Done.
That's what we're hearing about many private insurances, so that's great.
No questions asked.
That's the way it should be.
It's a $30 copay. I guess they would take care of that if I asked them.
Yeah.
I'm going to try.
They will. Whoever is insured with Aetna requires a pre-authorization, which most of the doctors know. So one of the other good ways is to actually call your insurance ahead and just say, hey, I want to get on this pill. Don't be confused. Many of the insurance agents have no clue what you're going to say. So you need to explain it a little bit. Tell them that you want to get on this medication and how is this medication covered under your plan. And then they will tell you in which copay tier they are, what's the deductible application, blah, blah, blah. But for most of the HMOs, it's covered as a preventative. It's basically covered in general because it's covered as an HIV medication, but it's covered as a preventative medication.
What is the age of the older person who takes the medication more reliable? I think, what are the statistics of somebody who's...
Maybe 30s and 40s.
No, so in that study, they enrolled people age 18 and up, and I think, I'm not remembering off the top of my head, I could look in this for you. I think it was like 18 to 25, and then 25 to 35, and then 35 to 45, 45 to 55, and above 55. And each category, people did better as you got older. I may be getting the break points between the categories wrong, but it was a clear increase in how well people took the pills as they got older progressively.
If HIV is more detectable by testing semen, why is blood tested instead?
So it's not that it's more detectable. So just so you know, you can't go into your doctor's office and say, I want the semen tested. It's not commercially available. Okay? It's actually a super hard test to do that people sit there, because there's all sorts of enzymes and stuff in semen that make the test very persnickety and difficult to do, so only research labs do it. So it's not that it's more detectable, it's just that if you are undetectable in blood, occasionally, if you test semen every day, about 20 to 25% of those days, you'll find low levels of virus. I can't tell you if it's virus that can go cause a new infection, or if it's non-functional virus, a dead robot. I can't tell you that. No one knows the answer. But you can find virus there, and that worries me.
And my second question was, you mentioned the vulnerability of, that a person is increased vulnerability if they have a viral infection or a flu. But, so that's my
No,
question.
no, 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 STDs.
No, STDs.
STDs.
Right, okay,
Not flu.
STDs, but what about a regular virus or bacterial infection?
Probably not. Probably not.
So just to say, gonorrhea, chlamydia, syphilis, trichomoniasis,
Herpes.
and herpes. Three of those are bacterial and they're local, so they are either in your mouth, your butt, or your pee or vagina. Whereas two of the other ones are viral, which means that they're in your bloodstream, basically. And depending on how they are acting in your body, they can basically. I always talk about it as in the sense of the immune system is sort of busy with them in certain locations, and then it makes it more permissible. You know, they can, like gonorrhea, I don't know if whoever has had it. I have, so I'll just talk about it. There is a white liquid that comes out of your front parts, basically, with gonorrhea. When you have it in your mouth, it's usually like, you know, you have a cough that doesn't really go away in your butt. Most people can't feel it and they don't see it because nobody can see their butt. Basically what it means is that there is an actual infection that is causing an ooze to be produced, which obviously creates a little bit of a door. So I think that that's sort of how we can talk about that. There is a chance that that increases the risk of transmitting or receiving, basically.
You said you were going to ask him the question. I actually live in Austin, Texas, and my doctor was a pathologist, and he said that he says that the only negative about the Truvada is the acid buildup that it goes to the kidneys or something.
So it can cause kidney irritation, but it doesn't build up
He says
acid.
they're going to be taking that portion out of the pill the first quarter of next year, and that won't even be a factor anymore. You haven't heard that?
No, it's actually not true. They're working on a new formulation of so Truvada has two components. It's got tenofovir in it,
Right.
and then it's got this thing called emtricitabine. Those are the two medicines that are in Truvada.
Okay.
So it turns out the patent is running out on tenofovir in 2017. So if you're Gilead, what do you do if your cash cow drug is gonna come off patent and be generic?
Right.
Well, you make a better version of it, right? So that's what they did, and it's something called TAF. And it's sort of a souped up version of tenofovir, and it's a lower dose and it spends less time in the blood. And so they're talking about that they're going to reformulate Truvada to be. That's the third time. It's staying down there. TAF and emtricitabine might be part of a new Truvada called Tafvada or something. I don't know what they'll call it. Anyway, so the idea is it's less kidney irritating, but it's not been studied for prevention. It's only been studied for treatment, and it's unclear if it gets into the rectal tissues the same way old tenofovir does. So it's unclear if it would actually work for prevention. So I think we're a long ways away from knowing.
Making assumptions.
Yes. So it's a great question, and thanks for bringing it up. And I do think we are working towards safer medications for PrEP, but we're not there yet. And just to tease you a little bit, the next thing is going to be injectable PrEP, and it's going to be an every 3-month injection, kind of like Depo-Provera. And that's something that's going into phase 2 clinical trials right now, which means it's not a 2,500 person study to show that it works. It's about a 175 person study to show that it's safe. Because if you give somebody an injection and it lasts for 3 months, it better be safe because it lasts for a good long time. So it better not make your kidneys explode or your head fall off. Or
And a question I should have wrote down, I'm sorry, Robert, but I know that people that are on HIV are supposed to take their medication at the same time every day, blah, blah, blah. But what about this? Does it work the same way, where like you're supposed to take it at the same time every day? And what if you don't? What if you're taking it every day at noon, but you forget you don't take it till 2, or you screwed up? Is it over? Is it done?
there's lots of forgiveness with it once you have it in your system for about a week. So what I tell people is as long as it's the same calendar day as you would normally take it, I don't care when you take it. But once it becomes that next calendar day, forget that dose that you missed and don't double up. Just keep going with what you were doing. It's not so precise that it has to be at 12 o'clock every day.
I was into it 3 weeks, and one day I screwed up 2 hours.
I think you're fine. You're more than okay. I would not even call that screwing up.
What I've discovered is that you take it when you do something every day, like brush your teeth, and there's something that I do every day, around the same amount of time. I plug in my cell phone every night before I go to bed, and that's when I take my pills. I get on my cell phone.
So basically, calendars, there's apps for it, there is, there's all sorts of things, but basically Google Calendar will text you, and you can even set that. In order to validate that you've done the reminder, you have to text back. So you can actually go back and check on yourself. And like, have you ever left the house and you locked the door and you like went into the car, you drove around the block, and you're like, shit, did I lock the door? You did that. It happens when you take medication too. So with brushing your teeth, it's really easy because you go like, oh yeah, no I didn't. But with taking a pill, it's a little harder to tell. So what you can do is you literally set it on Google Calendar, and then you just get a text from your Google Calendar, and you text back, and you're like, yeah, I love you too. And
Kids these days.
And there's also
like the Muppet Show.
There's also pill apps out there.
Who am I?
You're the bad Muppet.
Let's end on this. Is it conceivable now that a mixed status couple can have conceive a baby with this?
Yes, and yes.
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 Done. Yes.
It does become complicated if positive guy, negative woman, he's on treatment, undetectable, she goes on PrEP, they have sex the old-fashioned way, they conceive a baby, great, and then they decide, okay, now for the rest of the pregnancy, they're going to only have protected sex. Then you stop the PrEP, easy, okay, because she got pregnant, she's protected, no more unprotected sex during the pregnancy, right? And the reason you really want to avoid, more than the obvious one, transmission during pregnancy is a woman acquiring HIV during pregnancy is the highest risk situation for infecting the baby. So we ought to do everything you can to prevent that. But what if they're going to continue to have unprotected sex even though she's pregnant, right? Just because someone's pregnant, you don't stop having sex. But what if they decide they're going to continue to have unprotected sex? Now there's a baby, and now the woman who's pregnant is also taking Truvada all during the pregnancy.
Quick answer for this. What does Truvada have any effects with any other medication like antidepressants?
So there are some interactions, but not with antidepressants. It's mostly things that also irritate the kidneys, because the Truvada can irritate the kidneys, so you don't want multiple medicines that are irritating the kidneys. But there are very few direct medication interactions with it. Okay.
Even if you're taking PrEP, are you supposed to continue to use a condom?
The CDC says so.
Here's what I say. This is an incredibly complicated question that I think the answer is really, the words are really important here. Condoms are the best protection against HIV and the other STIs, those sexually transmitted infections. PrEP is great for the times when someone can't, won't, or doesn't use a condom.
Consistently.
Or the times when they don't.
Just one last question. I'm so sorry, I'm so curious.
That's right.
But earlier, there was one of you that mentioned superbug, basically. You know, the
Resistance.
Yeah, the resistance. And I don't remember hearing the follow-up on that. How does
Yeah.
that go?
So we've only seen it when people have been in that window period and started on PrEP. So the way you fix that is before you start someone on PrEP, you send that viral load test and make sure it's negative. That's what I do, that's what most providers do in clinical practice. It's not in the CDC guidelines. They say if someone doesn't have symptoms, you don't need to do that. I get hives, and that's the second time I've said that tonight, at the thought of potentially giving someone a resistant bug, so I do it.
What did you say? But there's no evidence so far that, people taking it and that the bug is going to get bigger.
No.
Like GMO.
Okay.
Isolating,
Yeah.
now the 2,4-D.
No. For the baby question, by the way, Bay Area Perinatal Aid Center in San Francisco is an incredibly good resource. Shannon Weber is one of their directors. Look them up if you have questions about HIV positive to HIV negative children, because they actually deal with this on a daily basis. And if you look up a BBC interview that I was on with Shannon Weber, she actually spoke with one of her clients or patients that was on PrEP and conceived a baby that was HIV negative with an HIV positive partner. So, woohoo, Ruben. Sorry.
And I just want to thank each and every one of you. Don't you think that tonight was very, very informative? Yes.